We seem so divided across this country on gun rights and gun advocacy. This legislation is really about after the fact of that. So whether you want to see less guns on the street or whether you're on the other side of this debate one way or the other, we do know that this violence takes place. And this package of legislation is, well, we've done a lot in New Jersey, obviously, about making sure that there are background checks and that the programs that we go through walk this line between protecting the Second Amendment and access to people to lawfully own a gun, but also to make sure that there are proper restrictions. This is really about what happens after the fact and how can we reduce the reoccurrence of this violence. Currently, recurrent violence-related trauma account for up to 45% of all hospital trauma admissions. However, if we can use these teachable moments when a person gets medical treatment for serious violent injury, like a gunshot wound, and leverage and partner with our hospitals and community organizations and healthcare providers to intervene with these individuals who are at risk for re-injury, and connect them with trained counselors and case managers to provide resources as far-reaching as housing, employment, and much-needed mental health and counseling services, there is a much greater likelihood that we can break the cycle of violence and save the community from another tragedy. Providing support to such evidence-based violence reduction strategies is and must be an essential part of New Jersey's comprehensive response to gun violence. That is what this package of bills is designed to do. We are looking to partner with hospitals and community health organizations in New Jersey to build a support structure for victims of gun violence, establish a grant program that helps target cities with disproportionately high gun violence that will serve to jumpstart these health-based prevention strategies, establish a more coordinated effort and remove barriers so that victims of gun violence get the services they desperately need, partner with our trauma centers, doctors, and healthcare professionals, and change the way we reimburse and pay for services so that victims of violence can access the care that they rightfully deserve. These bills will serve as a national model. Every day that we do not act, more people in our state are injured or killed by guns.